Our United States healthcare system quality is still lagging. What happened to healthcare reform?
What healthcare reform?
Yeah,
that
that's
was
about
purported
it.
to be healthcare reform, but we really didn't see much. The Affordable Care Act did a few things. It certainly gave insurance to kids up to the age of 26, okay?
That was a good thing.
That was a good thing. The thing about rescission, which means that if you had breast cancer, they couldn't just exclude you from the policy because they would just do that because they didn't want to spend the money.
Just drop you?
They just drop you, and then you'd have to sue them, and they'd say, go ahead, come after us and see what happens. So they can't do that anymore.
That should have been illegal anyway.
Well, of course. I mean, talk about something that's unethical. Wait till you're down and out, and then just yank your insurance? No, not right.
But over the last 5 years, I think it's become more expensive.
Health insurance companies have never made more money than they're making today. They're as wealthy as they've ever been. The pharmaceutical companies are. The only kind of healthcare reform we really saw was some economic healthcare reform. But healthcare reform, changing how we treat people, there wasn't any of that. There's no wellness and prevention. Those are still programs that need to be invented and applied to the U.S. healthcare system.
We have 81 million people at least that are underinsured or uninsured. And I think there's something like 40% of our adult population is in medical debt.
The biggest cause of bankruptcy in this country is medical debt. And there are probably more than 80,000 people that are underinsured and uninsured. And even the healthcare quality or healthcare that we're getting may be going to 30 million more Americans, which is what this was all about. And that's what they're saying was healthcare reform. But what are those people getting? I mean, they're getting Medicaid and Medi-Cal, programs like that don't reimburse much, that most doctors don't even want to be involved with for that reason.
Well, what happened that time you were called in the middle of the night to go to the emergency room to take care of a person that was on Medicaid?
Well, I was the backup for the emergency room, and it was a Medi-Cal patient. I went at 3 in the morning, spent an hour and a half, got a check for $3.47. I mean, you can't practice like that.
That's why a lot of doctors won't take Medicaid and Medi-Cal.
Well, Medicare is getting that way too, and if they make more cuts to that, you're going to see a change. However, medicine is still a business like it was before. It's not so much a service as it used to be 50 years ago. And when you look at the quality of health care that we have now compared to what we had in 2000, when we were ranked 37th in the world for overall quality of health care and accessibility, it hasn't changed much. There's still people having a hard time getting ideal health care in this country.
Well, our system is inefficient, and it's not really taking care of us. Like, people are often admitted to the hospital, and then they want to get them out as quick as they can because it costs a lot of money to have them in the hospital. But our readmission rates are really skyrocketing.
You discharge too fast, they come back too soon.
And then the administration costs are just outrageous. I mean, just a week ago or so, it was in the headlines of the newspaper about all the millions of dollars that the CEOs of the hospitals were making.
These are nonprofit hospitals, by the way.
Yeah.
That's right. So it's a big deal. When you look at the rest of the world, it's not a heck of a lot different, even though they offer universal health care. I mean, look at Canada. There are people coming from Canada all the time to the U.S. Why? So they can get a workup from their MRI or whatever other test that they need in a timely way.
Because they're standing in line to be able to take it.
Well, it may be months or even a year before some people can get the test that they need. And by that time, they may not even be alive.
But if we could move our position from 37 to number 1, it's estimated that we could save somewhere around 100,000 lives.
Yeah, it's unbelievable that's true, but indeed it is. So we have to look at what we're doing, and we, the people, have to make some changes in what we do.
We should have Occupy hospitals.
Yeah, really, maybe so. So we need to change so that we're able to get health care, but it needs to be affordable. So the system needs to change. We can't afford to spend $2.5 trillion a year on health care and still be ranked 37th in the world, which means you can't throw dollars after health care unless your goal is just to make profit. If you can get more tests out there and you can get more return on investment, that seems to be more important than providing service, which is, of course, what healthcare should be about. So when we look at the healthcare reform that we've had so far, it's a start, but not much. We need to change our thinking. We need to start thinking of wellness and nutrition and lifestyle changes that are important that we can adopt. We need programs to teach us that in schools, and we need programs to teach our adults that. And if we do, and we don't get sick as much, healthcare costs will go down. We'll be able to afford to do the high-tech things that now are throwing us into bankruptcy, and we'll have a healthcare system that's truly reformed.